Good morning. I'm going to talk today how to self-treat Achilles tendinosis, a very common condition in runners. In the acute initial stages, the best thing to do is rest, ice, no compression actually, or elevation, but certainly ice massaging the Achilles tendon. You also need to be aware of what caused the Achilles tendinitis, which can often be poor footwear. If your footwear is particularly hard on the rim of the foot, around the heel, that can dig into the Achilles tendon, or if you have boots that crumple up, that can put pressure on there as well. High heels for ladies. If you're wearing high heels a lot, your calf muscles and your Achilles will tighten up, and that makes you more prone to suffering from Achilles tendinosis. Teresa's going to help me now. We're just going to show you some stretches that are very useful for Achilles tendinosis. So we're going to start with gastrocnemius. This is the muscle that is higher up in the calf here. Okay. So Teresa's giving us a good demonstration. She's got her foot straight. She's not twisting it. Keeping her knee nice and straight, and then just leaning forwards at the hip, stretching out the muscle at the top of your calf, the gastrocnemius muscle. And when you do a stretch, you want to hold it for a good 20 to 30 seconds, which is a long time. Often people don't hold the stretch for long enough. And if we just get Teresa to bring her leg in slightly and do a soleus stretch. So the difference here is that she's now bending her knee. The soleus muscle is lower down in the calf, and you can see that stretching out lower down here. So when you do this stretch yourself, you should feel the stretching sensation move down. Okay. So we also need to do some strengthening exercises, and we can do that with eccentrically loading the Achilles tendon. And she's just going to demonstrate for us now some deep heel lifts. Now there's research that shows that by eccentrically loading, particularly in the acute stages, you can help to improve your Achilles tendinitis a lot more than if you just do a concentric and eccentric. So just to explain what that means, eccentric is when a muscle is stretching out under load. Concentric is when it is contracting. So what Teresa's doing here is she's resting her left leg on the way up, so she's not loading it on the way up. She then puts her toes down, and then she's loading it on the downward part of the stretch. So she lifts up, not unloading the Achilles tendon. She then weight bears on it, and she loads it on the way down. And that's eccentrically loading her Achilles tendon. As you advance and as the condition improves, so you can concentrically and eccentrically load. So if we just get Teresa to demonstrate that now, so she's just loading on the way up and also on the way down. Okay. Now once we've got her on the step here, you can also stretch your Achilles tendon on the step with both feet dropping down, or as you improve, you can just put all of your body weight. So if I just get Teresa to lift up her other leg, so in the advanced stages you can put all your body weight onto your left leg and stretch out your Achilles tendon. Okay. Other exercises that you can do for your soleus muscle is squats. So we just get Teresa to demonstrate that. So feet sort of shoulder width apart, both feet down, and then she's just going to squat down, pushing her knees forwards, okay, stretching out her soleus muscle. Okay, and that's a good way of, in the early stages of just stretching out the soleus muscle. And the other, and as you advance and as the condition improves, so you can do a single leg squat. So if we just get Teresa up with her feet flat to start with, and then she's just going to stand on her bad leg or affected leg and then just squat down on the one leg, pushing her knee forwards, feeling a stretch. So the stretch is here, okay, and you're just going to be a bit careful with this if you've got any knee problems, because it does load up the knee quite a lot. And then I teach people, as they stretch, they push their knee inwards. So if I can just get you to do that, Teresa, so just pushing your knee in, and then pushing her knee out to the side. So it just stretches different fibres within her muscles here. Okay. I often teach people to get a board, so we've got a rocker board here, which is on a slope, and you can use that rather than just dropping your heel off of a step. It's kind of an intermediary between flat on the floor and off of a step. So if I could get Teresa just to demonstrate some exercises on there. So if we just start with a calf stretch, gastroc stretch. So left foot is the affected side. She's going to keep her, she's doing a soleus stretch here, so she's going to bend her knee, pushing the knee forwards, and again you can see the soleus muscle stretching there, and she would hold that for 20 seconds. Okay, and then the other way of stretching your calf muscle, gastrocnemius, is to keep the knee straight, and then just push your hips forwards, and again you can feel that. That's kind of an intermediary between having your feet flat on the floor and doing it off of a step. If you don't have a rocker board, you can just get a bit of board out of your garage and place that up against a step, so you've got a slope that you can do that against. And the foam roller, form of self-massage. Here we have our foam roller. So if you come for treatment to us, then we will do massage and trigger point release, but you can actually do a lot of this yourself. So what Teresa's doing here is she's just using a foam roller. It's a tube. She can put a body weight down through her calf muscles and just roll her backwards and forwards. And what this will do is it will put pressure on trigger points and adhesions and then tight points within her calf muscle and help to release those tension points. And she's just rolling backwards and forwards with pressure, and she's a very good model. She's rotating to change the pressure that she's applying to her calf muscle. And the further up the calf you go, it's more your gastrocnemius muscle. The further down you go, it's more your soleus muscle. With Achilles tendinitis, you're going to want to foam roller the more tender points, which will generally be lower down. So at the moment, that's gastroc, and then she's just moving down onto her soleus muscle now. Okay, thank you for that.